It's Patrick Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question in this series of questions from my client Veronica. And the question last week was part 1 of my 71-year-old dad is in ICU with stage 4 lung cancer and stroke. He's on the ventilator now and in an induced coma. What are his chances of survival? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from one of my clients, Veronica, which are excerpts from phone and email counseling and consulting sessions with me. And the question this week is part 2 of my 71-year-old dad is in ICU with stage 4 lung cancer and stroke. He's on the ventilator now and in an induced coma. What are his chances of survival? So after I had the first phone counseling and consulting session with Veronica, I sent her a summary of the session, and you can find below how things progressed from here. So Veronica writes, I have written back to Veronica first in this instance, so here is my response to Veronica. Hi Veronica, it was very nice talking to you. I hope the information I gave you was useful. So please follow up with the doctors on the following. What sedation is your dad on besides the fentanyl? Is he A, on propofol, which is a short-acting sedative, or is he B, on midazolam, a long-acting and also addictive sedative? I have provided you with more information about ICU sedation in general, and I put a link again in the written version of this blog below this video about sedation in intensive care. Next, ask them why your dad's ejection fraction has gone down to 35%. Have they ruled out a heart attack? In order to investigate if he had a heart attack, they would have to do the following. Check the troponin levels in his blood. Do an ECG, do an ultrasound or echocardiogram, or even do a TOE, a transesophageal echocardiogram. Next, ask them if he's getting any anticoagulation besides the aspirin. He may get some clexane or enoxaparin or heparin for anticoagulation, which are also known as blood thinners. Also, keep asking for blood results such as hemoglobin, platelets, white cell count, neutrophils, etc. If neutrophils are close to 0, your dad needs to be isolated. Especially after chemotherapy, the immune system is weakened and therefore white cell count or neutrophils may go down significantly. So, here is Veronica's response. Veronica writes, Hi Patrick, thank you so much for your advice and information last night. I have emailed you to reply to the questions that I had to find out from the hospital and the doctors. I have made a lot of notes and called all the relevant doctors today who are responsible for my dad's care. Please see my answers here to the questions you said I should ask the doctors about from your summary email. I called the critical care consultant and he said this morning that my father is on propofol and he said we need to be prepared for a hard week with more tough decisions. He also said he wasn't going to be at the hospital this week as he swaps shifts with another hospital, and that another doctor, Professor so-and-so, will be looking after the critical care unit this week, including my dad, and he was doing a handover this morning. He also said dad is on a medium dose of heparin and aspirin. My father had an echo of the heart done today. I also forgot to tell you that my dad is on thyroxine. His thyroid burned out after the first lot of chemotherapy about 18 months ago. I contacted my dad's GP, who is a personal friend with my dad through the years of my mum and dad being his patients. His general practitioner was not fully aware of the whole situation, since it got even more serious 2 days ago. Dad's GP also happens to be good friends with the appointed cardiologist, as well as the cancer specialist, and they're all friends with the GP. The GP said the cardiologist said his heart should come back to normal once the infection and the pneumonia that caused the fluids on the lungs from the chemotherapy settles down. He also said the cardiologist wants to repeat the echocardiogram when the heart recovers on its own if it is stress-related, which the cardiologist thinks it is, and if it doesn't improve, it could have been a heart attack. He also said there is no suggestion from the echo that was done on the 31st of March of previous scarring, but the heart remains weak globally. I then also called the cardiologist, and he spoke to me at length, and he said he wants to repeat the echo once the heart recovers on its own, probably this Wednesday or Friday. He also said he didn't want to risk an angiogram as my dad had blood on coughing before he had his bronchoscopy. He said if the next echocardiogram is normal, he will put it down to stress myocardiopathy. He said he will try to avoid an angiogram for at least 6 months. He also said Dad's heart refraction is in keeping with viral and stress myocardiopathy. He said Dad will need to recover totally to be able to have an angiogram. He also said further treatment for the heart artery would need Dad's oncologist to consult, and state that Dad has a minimum of 12 months or more to live. He also said they are giving Dad perindopril, an ACE inhibitor, to treat his blood pressure to calm down the system. He said he cannot have beta blockers at the moment. He also said he looked at the chemotherapy drugs Dad has been on, and he said they are not causing the weak heart. He believes that Dad has heart stress, or very unlikely had a heart attack at some point, but no markers lead towards that, he said, and that has resulted in his weak heart. He also said he thinks that Dad might have aspirated, and that has caused the recent pneumonia and further complicated the situation, and that is why he needed to be sedated also. No one has confirmed the aspiration to me, and the cardiologist said he would be seeing my dad this evening. Once again, he said do not worry about his heart. He thinks it's the lungs that are the concern. I asked him, have they ruled out a heart attack? And he said no. I then asked him why his ejection fraction has gone down to 34%. And he said from that report, he said he has not ruled out a heart attack. However, he said he believes it was unlikely to have been one, as his troponin levels in his blood were in the hundreds and not in the thousands. I requested the echo report that was done after Dad had the pulmonary edema. He's going to investigate further with the other echo, but due to risks will not do an angiogram. I now have a copy of the echocardiogram and ultrasound that was done on the 31st of March. If you need any details, please let me know. Now, also, I visited Dad after work today, this afternoon, and asked the nurse on duty about his bloods. She said his white cell count blood is slightly up but lower than yesterday. His hemoglobin is down slightly. His fever is completely under control at present, and I asked for blood results, but no one was around that could give them to me, so they said if I ask in the morning I should be able to get them. The next part is very important. When I said hello to my dad, he responded and put his hand up and opened his eyes. Now, as you know, my father is under sedation and in the induced coma, but the nurse said he's responding to questions. I spoke to Dad, and he's listening and able to answer my questions by nodding and squeezing the hand. Is this safe and okay? He indicated he's not in any pain, and on one occasion he opened his eyes to see me. I am concerned he is aware of too much. What are your thoughts, please? Also, the nurse said this is not very common to be so responsive with the sedation. I hope he's not too aware and not in any pain. Is this good or not good? Do I need to speak up to the doctors for him? The nurse said he's not resisting to the ventilation, so they're not too concerned. Thank you for your advice again, and please let me know where to from here and if I need to obtain more information and what I should know daily and what to ask for from them. Many thanks from Veronica. And before I get into my response, if you want one-on-one counseling and consulting with me, just click on the link on the top of the website, one-on-one counseling and consulting, and select from the options that work best for you. So here is my response. Hi Veronica, thank you for sharing all this very useful information. You have already done a crash course in intensive care, and I can see that you are a quick learner. It's good to hear that your dad is on propofol and not on midazolam. Propofol is short-acting, and therefore once propofol is stopped, patients tend to wake up a lot quicker, sometimes within minutes or even hours. Midazolam, also known as Versed, is a long-acting sedative, and therefore it takes a lot longer for patients to wake up after the induced coma. Therefore, I'm not surprised that your dad is responding to you and your family, and those are all very good signs. Generally speaking, waking up after an induced coma is more like switching on a light with a dimmer rather than switching on a light with a switch. Waking up after an induced coma is a process and not an event. I have written about this extensively, and you can check out other resources such as How Long Does It Take to Wake Up After an Induced Coma? Or have a look at the 5 mistakes you are unconsciously making if your critically ill loved one is in an induced coma and is not waking up. Or check out the 10 answers to the 10 most frequently asked questions when your loved one isn't waking up after an induced coma. It's also positive to know that your dad is responding, especially since he had a stroke a few days back. As far as the doctor's comment is concerned about making tough decisions in the next few days, my advice is to ignore any negativity for now and just keep asking the right questions. Intensive care teams are negative by default, and whilst I agree that your dad's prognosis is poor, negativity is not going to help anyone but the ICU team who wants to manage their financial budget, manage their beds, their staff, as well as their medical research interests. Furthermore, if your dad's troponin levels are in the hundreds, it's unlikely that he had a heart attack, although they haven't ruled it out yet. I think they're just cautious, which is fine. Also, if your dad has an aspiration pneumonia, there is a good chance he might have aspirated during the bronchoscopy. You clearly noticed a deterioration after the bronchoscopy from what you shared yesterday on the phone. This is probably also why they had to intubate him. Intubation is the insertion of the breathing tube, and put him on the ventilator within the next 24 hours. With stage 4 lung cancer and an aspiration pneumonia, the prognosis will be poor going forward. However, that doesn't mean your dad can't come off the ventilator over the next few days. You have to wait and see. Therefore, I also agree that the lungs are the problems and not so much the heart. The reality, though, is that you can't look at either the heart or the lungs in isolation. Lungs and hearts are connected, and they rely on each other to function properly. Moreover, please also keep in mind that your dad's white cell count, as well as his red blood cells and hemoglobin levels, are probably going down because of the side effects from the chemotherapy. Furthermore, I agree that a beta blocker like metoprolol would be contraindicated, and even though you haven't mentioned it, your dad is most likely on noradrenaline or norepinephrine or any other inotropes or vasopressors to maintain a physiological blood pressure and cardiac output. Cardiac output is the contractility of the heart, which, whilst he has a compromised ejection fraction, which is something you mentioned. The goal you should be working towards is to make sure your dad is not suffering and that he's getting the best possible care and treatment until he might come to a point where you can ask him what he wants. If he doesn't reach that point, You then need to make decisions on his behalf, and it'll be good for you to think it through what you want for him. We can discuss this on our next phone call. Because I have seen a situation like this hundreds, if not thousands of times, after nearly 20 years intensive care nursing experience in 3 different countries, I can tell you what's going to happen next. The intensive care doctors will probably ask you to agree to a quote-unquote withdrawal of treatment as being quote-unquote in the best interest for your dad, as he won't have much time to live. At the bare minimum, they will ask you to sign an NFR, not for resuscitation, or DNR, do not resuscitate order, in case your dad's heart stops. Again, I wouldn't do any of it because you want to wait until your dad wakes up so you can ask him what he wants. Usually, what pushing towards a withdrawal of treatment or an NFR or DNR means is that the ICU is really pushed for beds, or they're running out of money, and they frame it as if it was quote-unquote in the best interest for your dad because he wouldn't have any quality of life anyways. Don't fall for it, and don't even go there. The most important thing in intensive care is to read between the lines and understand the dynamics and what it all means. What is happening behind the scenes in intensive care is so powerful that you need to understand it rather quickly, and you can do so by checking out the 10 things you didn't know are happening behind the scenes in intensive care that hold you back from making informed decisions, having peace of mind, control, power, and influence. And again, I put a link towards this article below this video in the written version of the blog. It's also good if you can have a look at another resource to learn about withdrawal of treatment as well as NFR and DNR. And the name of that resource is the 5 things you need to know if the medical team in intensive care wants to withdraw treatment or wants to issue an NFR or DNR for your critically ill loved one. Again, there is a link to that resource in the article below this video. Furthermore, cardiologists always want to do the angiograms because that's their bread and butter. But I do believe at this stage, until they have evidence for a heart attack, or if ejection fraction deteriorates further, there is no need for that whatsoever. Also, your dad probably won't need another procedure at this stage. For now, stay put and wait until your dad is getting more awake so you can ask him what he wants. Do not respond to any pressure from the intensive care team. You are in charge of your dad's fate and destiny as long as he's alive, because you have all the right information at hand. With the propofol coming off, he should get more awake, and having said all of that, the fentanyl might make him sleepy and might make him drowsy to the point where he won't breathe by himself enough to come off the ventilator. He will most likely need the fentanyl for pain relief, and therefore he may not be able to come off the ventilator, but it's too early to see, and wait and see what's going to happen next. Wishing you all the best for now, and talk soon from Patrick. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me. Find international phone numbers on the top of the website. Also, check out our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype over the phone or via email by clicking on the Products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.